Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Mental health is considered as a fundamental part of general health, as it is a state of wellness that enables individuals to activate their abilities and potentials in order to deal and cope with different life conditions, work productively, and contribute effectively within the family and community. Therefore, mental disorders interfere with this state of wellness. Some examples of mental disorders are depression, anxiety, schizophrenia, obsessive-compulsive disorder, drugs and alcohol abuse, behavioral disorders, and suicide. Currently, there are more than 450 million people suffering from mental health problems worldwide. 1 out of 4 individuals suffers from mental health problems at some point in life. 150 million people suffer from depression. 38 million suffer from epilepsy. More than 90 million suffer from alcohol and drug addiction. Every 40 seconds, one person in the world commits suicide. There is a strong association between physical and mental health. We find, for example, that individuals with chronic physical illnesses are more vulnerable to some mental disorders. The prevalence of major depression reaches up to 33% in patients with cancer, up to 29% in patients with hypertension, up to 27% in patients with diabetes, and up to 22% in patients with cardiac problems, compared to 10% in the general population. The burden of these disorders is enormous and includes emotional and economic struggles for both individuals and the community. Despite all these burdens, most developing countries devote less than 2% of their general health budget to mental health care. And although cost-effective treatments are available, 76% to 85% of individuals who suffer from severe mental disorders in developing countries have not received treatment in the last 12 months. The mental health field is subjected to neglect all over the world, and a negative stigma has always been associated with mental disorders, which creates obstacles to receiving treatment.
الفكرة إنه الطب النفسي إشي مخيف أو إنه الشخص إنه إذا بتعالج نفسيا إنه هذا مريض إنه ما لازم واحد يقرب منه إنه صعب التعامل معه.
Various violations of human rights occur in most countries of the world, directed towards people with mental disorders, such as deprivation of food and water, deprivation of the right to marry or work, deprivation of treatment, or provision of compulsory treatment, in addition to physical restraint and seclusion in isolation rooms. The topic of human rights violations in the mental health field has started to gain much attention and interest worldwide. In Jordan, actions concerning this issue have started to take place, as the mental health system is weaker than other health sectors. There is a shortage of human resources in the mental health field. There is approximately 1 mental health worker to every 130 workers in general health. As such, in 2008, a project to reform the mental health system in Jordan was initiated, led by the Jordanian Ministry of Health and supported by the World Health Organization, with the participation of relevant stakeholders, such as the Jordanian Nursing Council, universities, and others. A national committee for mental health was established to develop a national mental health policy and a plan for its implementation. The main objectives of the mental health system reform are, first, to shift from the biological approach to the biopsychosocial approach. As mental health disorders have biological, psychological, and social causes, the treatment provided should therefore include all these aspects. Second, to shift focus from providing mental health care in psychiatric hospitals to community mental health services. Third, to improve the quality of care provided. 3 community mental health centers were established to serve Jordanian and non-Jordanian citizens. These centers provide therapeutic services according to the biopsychosocial approach through multidisciplinary teams. Each team includes a psychiatrist, a psychiatric nurse, a psychologist, an occupational therapist, and a social worker. The teams apply the recovery approach, which counters the incorrect common belief pervading society that people with mental disorders cannot recover and live normal lives. Also, the clinics emphasize principles of human rights, respect confidentiality, and involve service users and their families in treatment and rehabilitation. The clinics also provide other services, such as educational, rehabilitation, and recreational activities. In order to upscale mental health services in the kingdom, the Jordanian Ministry of Health is working on integrating mental health services into primary health care.
كما تعلم بأن وزارة الصحة لديها نظام قوي في الرعاية الصحية الأولية يتمثل من خلال 668 مركز صحي موزعة في جميع أنحاء المملكة. هناك أهمية للكشف المبكر، والكشف المبكر لا يتأتى إلا من خلال مركز صحي. المركز الصحي قريب، سهل الوصول إله.
Jordan has been selected as one of 6 countries in the world to implement the Mental Health Gap Action Program, in collaboration with the World Health Organization, to reduce the high number of people who need treatment for mental health problems and yet do not receive it. In Jordan, the World Health Organization has provided the opportunity for 3 mental health professionals to attend the International Diploma on Mental Health and Human Rights program, held in India. The goal is to establish a group of specialists on the issue of human rights and mental health in Jordan. The success of this project has been made possible by the strong efforts of the Jordanian Ministry of Health, the support from the World Health Organization, collaboration with several stakeholders, and the constant support of the royal family, especially Her Royal Highness Princess Muna Al Hussein, under the umbrella of His Majesty King Abdullah II. We look forward to upscaling the mental health system in Jordan to meet the needs of the population.